where we have the sodium affecting the volume of water inside those cells, which causes swelling or shrinking depending on the situation, which will then cause changes to the pressure on the afferent arteriole. And remember, the efferent arteriole is not as much affected, so what happens is the flow through the glomerulus will actually either backlogged or it will actually have an increase of the flow, so that will actually change the pressure amounts going into the glomerulus, which affects, like we said yesterday, glomerular filtration. So I'm going to write that back up here. And I'll put down tubular filtration, because we're going to get to all these, and then we have tubular reabsorption. Okay? And here's one of the interesting things. You have the same number of nephrons when you were born. Isn't that interesting?
So you have the same number all throughout life?
Yeah. They just increase in size.
I'm sorry, same number of what?
Nephrons.
Nephrons.
You know,
Number of
you like
nephrons.
nephrons, you know. Okay.
It just changes
It
size.
changes in size in the kidney as your kidney increases in size. Okay.
Does that mean like, yesterday when there was 2 nephrons, what was kind of organized and what was not, is that why, or was that the size difference?
That's a size difference
Oh.
between them. Remember the conical ones are more in the cortex as opposed to the juxtamedullary, which lengthens and actually goes more into the medulla. Okay, so there is a difference also as far as those two. You missed all this, Karen.
No.
Okay. Okay, good. I wanted to make sure you're not wondering and a little bit having an issue catching up with it. Now, one of the things that we do see is, as you'll see in the third item, we do actually have AD, ADH, and aldosterone. These are 2 hormones. ADH is antidiuretic hormone. Now, antidiuretic hormone, one of the things about this is actually produced in the posterior pituitary gland of the brain. And what it does is it actually causes an effect as far as reabsorption, basically. And so when we're looking at it, it does actually have a direct effect on certain cells, okay, which is what we're going to go into, okay? Now, let's go on. When we look at the capsule, we already looked at this. So, you know, and this is basically simple squamous epithelial within the capsule, glomerular capsule. When we actually look at the cells, they look like these. So you have a variety of them. You'll notice that basically the proximal convolute tubule has mostly cuboidal, simple cuboidal. The loop of Henle actually goes from simple cuboidal to a more thinner, which is more simple squamous, which you see right here. It then actually goes in the ascending loop of the loop of Henle, where we actually go from a simple cuboidal to a simple columnar. And we also have, you know, like I said, actually coming in contact with the afferent arteriole, which is where we have what's called the macula densa cells that actually increase or decrease and actually cause the pressure differences based on what's going on. Sodium relating to the water, okay, autoregulation, hormonal, and there was one other, and I still haven't thought of it, but we'll get to it today, okay? In the distal convolute tubule, in the collecting duct, we have simple cuboidal, And that's where we have a lot of the microfilari, where we actually also have the last portion of reabsorption of water, right before the collective duct. So when we're looking at the juxtaglomerular apparatus, we saw an image of this in the lab yesterday. Do you guys remember that? And I pointed it out to you to really keep an eye on it. So what we're actually seeing, here's our afferent arteriole, here's our glomerulus, here's our Bowman's capsule. Right here is the loop of Henle, and along this edge is where we have the macula densa cells, which are the ones that are primarily affecting the afferent arteriole. So when they actually increase in size, they actually change the pressure. Or when they decrease in size, they change the pressure. And that affects the glomerular filtration. Okay? So one of the things that we see, and we talked about just a couple moments ago, the number of nephrons stays the same, unless you get injured. Okay? But they're not replaced. Which is one of the reasons that when you actually have kidney dysfunction or damage, it doesn't actually recover from it. Okay?
So what happens if you lose?
So what happens if you lose? You decrease the functionality of the kidney. And I told you some stories last night, I believe, right? Yeah, I told you about my colleague, I told you about some others. So one of the things that we see is when we do see a decrease in 25% of the function of the kidney, that's when the nephrons are really overworked, okay? But we can actually live with one kidney, and it's perfectly fine. And it can do, we do 80% rate with the two kidneys. Now, let's talk about one other thing. I'm going to talk about this in a moment. I have another example I'm going to give you guys. So when we're looking at it, this is what the overall of what we just talked about with the three functions, okay? So overall, basically when we're looking at this, glomerular filtration is what we really have to look at as far as what's going on with the blood initially. Secondarily, then we get the reabsorption. Thirdly, we get the tubular filtration, basically, okay? But the primary one is actually the glomerular filtration. And if that's not, if it's not functioning the correct way, what's going to happen is that's going to affect the others in some ways. Because one of the things that happens, sodium, like I said, sodium is the primary electrolyte that's actually affecting kidney function. Chlorine follows it. Potassium, reacts according to it. So we're going to talk about all these other electrolytes as we go along. When we also have a chapter that's going to be the next chapter, which is going to be electrolytes, fluid balance, and pH balance.
The first filtration is trying to filter out
The majority of the waste products. Okay, and this is where, like I said last night, you can filter through glomerular filtration 9 liters of fluid per day. How much is 9 liters in gallons? Have any idea? 1 gallon, or shall I say 1 gallon is 3.36 liters. Okay? So you're doing quite a bit of filtration there. But most of it gets reabsorbed, like I said. And we talked about this already, so I'm not gonna... we talked about that, we saw that, and glomerular filtration is where we're really at as far as this is concerned. Okay? So, when we're looking at it, Oh, my mistake, it's 48 gallons per day, my mistake. And you only get 1 to 2 quarts of urine. Even more extreme. I kind of forgot the detail, but that's okay. You know, it gives you a better insight numerically, right? You guys know how much 1 to 2 quarts is, right? 1 to 2 quarts?
Quarter
Quart.
to a half a gallon?
Yeah,
1 and 2 is
well,
a quarter to a half gallon.
1 quart is a quarter of a gallon. 2 quarts is it's about a half a gallon. So, you know, you guys have an idea of volume-wise what that looks like. One of the things that we do see is when we're looking at this, like I said, blood pressure really has a big factor in this. So I do want you to realize this. And what we filter out mostly is sodium, water, electrolytes, things like that. We do get some nitrogen-based filtrates coming out too. And I want you to realize that. So one of the things that we do not get is we do not get larger structures. For instance, you get blood coming through, but you don't typically get blood going and getting filtered out, going through the nephron.
Do you have these slides on Google?
Not yet.
Maybe you'll put them on before we take.
I'll see, I'll see. You guys wanted me to put up the PowerPoint instead, so I'm doing that tonight. Okay? I'll see, Anyway, but this is what we actually see going on. And when we were looking at the filtration, like I said, it stops cells, it stops blood cells, it stops proteins, basically. Okay? For the most part. All right? But you do get glucose going through at the glomerular filtration. Okay? And we looked at the next slide already last night. And one of the things that we see is the different types of pressures that actually affect it. Now, glomerular damage, or one of the things that we do see is we get reduced amount of functionality for the capillaries being permeable, and that's a big problem. I mentioned last night that one of the things that happens is when we actually see proteins in the urine, it's indicating one of 2 things. Number 1, infection. Number 2, nephrotic damage. Damage that the nephrons are breaking down and actually leaching out proteins.
Which means
They're, yeah, it's breaking down and going out.
You said protein in the urine is nephrotic damage. What was the other option?
Infection. Serious infection, okay? Not just a minor infection, okay? So when we're looking at, how it affects things, a lot of it is where we do look at the rate of how much urine is produced and released. So when we're looking at the typical adult male, you actually have 125 milliliters per minute being, as a baseline as far as what's going on normally. Okay, if you're actually getting in filters, yes. If it's a change to this, then we can actually say what's going on. And remember, if we actually have a patient that they're having problems with their kidneys or kidney function or urinary system in general, we then track fluids. Meaning, you put in a Foley catheter, you guarantee how much fluid is coming out of them per day. You track how much they're putting into their body. If they're actually urinating less than they're getting put in, that tells you something's going on. That's not correct. All right?
What could that be?
What could that be?
So my brother, he had prostate cancer.
It could be
PSA.
something else. We don't, then you look, what's going on, that's all. Yeah, and keep in mind, the prostate is one of those things that may actually, because it's cancer or even just other issues, it'll swell and it'll prevent urine avoiding the process. And I've seen, unfortunately, geriatric patients where they struggle with, they leak or they're incontinent, and they may also have difficulty urinating. So there's a lot of issues. Yes?
If you have like an unknown swellness in your body,
An unknown what? Swelling? Okay, I wanna make
You
sure,
guys got one point.
I wanna make sure I understood.
But yeah, then they usually check your kidney functions too.
Yeah, they do. Because a lot of times what happens is you may actually have a buildup of fluid someplace. Let me give you an example of this that may, and you think about this. Cancers are really interesting in the sense that they actually draw more blood flow, because the blood flow increases the growth of that tumor or tumors. I had you're gonna love this one, I think, maybe not. I had a professor in grad school. She was a large woman. I'm going to say that again. She was a large woman. Large, yes. Jim, could you stand up for a second, please? Just to get a perspective. Yeah, she was about that tall. And she was about, I'd say 1.5 pot, 2, maybe a little bit larger than that. Okay, of you?
Yeah.
Around? Okay, so like, I'm not saying bad things, I'm trying to give you a concept of size. Her mother was also quite sizable. Okay? That's a nice way to say it, right? Okay. Her mother had some difficulties abdominally. She didn't know what was going on. They did a little testing, blah, blah, blah. They did, and what happened was they found a benign growth. Benign. Non-cancerous tumor. The size of a basketball. In the abdomen. Okay? And it wasn't found before. Oh. Sizable person, sizable tumor, not discovered early enough, earlier. Things happen sometimes because they're missed. Volume is, big, okay? It happens. You're trying to put, basketball, and they didn't notice it there before. Okay? Just to give an idea. So things do happen, and a lot of times we look at it to try to see what's going on. Now, here's another idea that I want you guys to think about. When we do regulation of the glomerular filtration, we have autoregulation, neuroregulation, which means we're actually looking at the nerves, and we have hormonal. It was neural that I forgot. I couldn't think of it. Okay? So we do have these things going on. And they are a feedback mechanism where they actually control, somewhat, to actually control. And they do have overlap. What do we mean by autoregulation? Well, you guys might remember we talked about this as far as the afferent arteriole with the juxtamedullary system. Excuse me. We have nerves. What does that mean? That basically is talking about the sympathetic and the parasympathetic nerves that may have a role, and they may actually influence what's going on. We also have hormones that actually increase or decrease the filtration, okay, by hormonal controls. So we're gonna talk about that, just so you guys know. So when we're looking at it, they have a feedback mechanism. Here's a nice diagram of the feedback mechanism. You actually have filtration, and a lot of it's based on what is happening as far as the filtration. And you'll notice what's shown here as far as the autoregulation, where we have the juxtamedullary apparatus actually affecting that as far as details. A lot of times the water and the sodium is what's being detected also. Okay? So when we're looking at it in more detail, we have a stretch effect going on at the afferent arteriole, which is then determining that what needs to be done. We also have the tubes where they're actually affected by sodium and chlorine and water not being reabsorbed. And that will actually then affect the juxtamedullary aspects where we have the macula densa to actually increase blood flow so that it can actually increase the amount of filtrate.
So they're not being reabsorbed?
No.
Tubules?
In the tubules. And here's the interesting thing. Let me draw that so you guys can remind yourselves of what we're really looking at here. You guys might remember the nephron looks something like this, where we have Bowman's capsule just like this. And I'll just draw the proximal, the loop of Henle, the distal, okay. And then we get the collecting ducts, okay, right over here. Okay, but when we're looking at the blood flow, we have the afferent arteriole, the glomerulus, the efferent arteriole, and then it goes over basically this whole area, okay, before it actually goes into the veins. So when we're looking at it, a lot of times when we're seeing these, the tubes, we actually have sodium in here and water, and sometimes because of diffusion, it will actually leave, and I'll do it in both directions so you guys can see it, because of diffusion. And because of that, what's going on here, it will actually increase the levels of sodium in the tissue space, at different points. And what will happen is it will then over here may actually affect the sodium moving back in at the ascending loop of the loop of Henle, and that's going to then change the concentration of sodium, which will then affect water. Okay, does that make sense? All right, and I may be drawing it very quickly, so don't give my arrows too much notice, because, we're gonna see some things affect at many different points. Okay, neural regulation, basically what we're looking at is a couple of hormones. They do actually have an effect. These are more sympathetic nerves. Sympathetic nerves, you guys know what sympathetic nerves are versus parasympathetic? Yes or no? Yes. Do you guys recall that from any time you may have heard of them? Yeah, sure, I just want to make sure. When we're looking at your nervous system, you actually have various portions. We're going to talk about it, of course. Sympathetic, let's see. And I think I'm misspelling it because I'm trying to get it very quickly. The sympathetic nervous system versus the parasympathetic. Okay, and I want you to realize that we're talking about the differences in this. Parasympathetic is more relaxed or resting, whereas the sympathetic is more of the increased activity, the heightened activity.
The fight or flight.
Fight or flight, yes. That you guys have heard of, right? You guys know what that means, right? You go into an establishment to have something to eat, something to drink, you know, somebody bumps you, you're having a couple, drinks. Sympathetic, you reacting to bash their head off, okay? Parasympathetic, you're just relaxed, calm, don't do anything about it.
It gets you back to normal.
What's that?
The parasympathetic gets you back to normal, so you're homeostasis.
And I've had situations where you're driving and you may actually not notice something and you move into the wrong lane. High strung with the sympathetic having an effect, they get road rage.